Hola mi gente, it's Alondra La OT, and today I'm going to be talking about fieldwork with my very special guest. Stay tuned. Hola mi gente, so for today's video, I'm going to be interviewing my former classmate Joy, but before we get into that, it's time for Tres en Treinta. Alright, first question, ready?
Yes.
Alright, top 3 favorite leisure activities, go.
Number 1, I would say going to the beach.
Okay.
Number 2, taking my dogs for a walk.
Okay.
And number 3, let's see, playing with my godchildren.
Okay. Favorite food?
Nachos.
Ooh, I love nachos. Okay. And where are you from originally?
I'm from Illinois.
All right. 23 seconds. Yeah! All right. So when we say fieldwork, we're going to be talking about level 2 fieldwork. And I know some of you guys are going to be entering fieldwork soon, so hope this video comes in handy for some of you. First of all, what fieldwork settings were you at?
I was in a skilled nursing facility for both my placements.
And I was in a spinal cord injury acute care and a mental health senior outpatient program, so very different. Still phys dis though for one of them. Was there anything that you did to prepare for your skilled nursing placement?
Yes. Knowing total hip precautions, knowing appropriate levels for like blood pressure. For instance, if a patient has orthostatic hypotension, you want to make sure you're taking blood pressure before, during, and after treatment.
Right.
So it's very important to keep that in mind.
One of my placements, my CI, she actually told me to look up the dialectal behavioral therapy model because that's what they use. And then for the other placement, my CI gave me the FIM, and she told me to like read up on this because we'll need to know this for this placement. So
and I also utilize the FIM.
Yeah,
my first.
That's a popular one in phys dis, so that's a good one to know, guys.
My second fieldwork placement, we typically utilize the Barthel Index. So it's very important to know like different assessments. We're always supposed to utilize a standardized assessment. I took it upon myself to look those up beforehand.
All right, second question. What were the biggest challenges that you had to overcome during fieldwork, if any?
So I found difficulty with time management. Transitioning from a student to a therapist, you need to really learn how to manage your time with like patient care and with documentation, especially with evaluations. It takes time. It's very tedious. There's a lot to enter, information to enter. You have to do chart review. And really just like knowing the patient's condition and what that entails. And so be prepared to, one, be efficient, but also provide quality documentation.
What did you use to help keep you on track for time management?
I did not wear a watch because I personally do not like watches, but I would recommend one anyway.
I'm like, I have to have a watch.
But I did.
And
I continually looked at the clock, and I continue to look at the clock as a therapist.
Yeah, I know, because she's a practicing therapist now. Yeah. So third question, what do you feel is the best advice you can give about communication between you and your CI?
So the best advice I could give about communication is always have open discussion, always like ask for feedback, always be receptive to what your fieldwork educator has to say. Do not get defensive.
Yes, and I think that's a challenging one for people because as students we want to do good, and that carries over into field work. You know, we want to do really, really good work. And so I feel like it's hard at times to get feedback from our CIs without taking it personal. And then also checking in with them and asking them, is there anything that you should be doing? Is there anything that you should change? Just staying on top of that communication because you don't want to get to like week 3, 4 and find out that you're not doing as good as you thought you were.
Yes.
So keep that open line of communication, guys. Very important.
Very important.
Any final advice that you can give to people that are entering fieldwork?
So the final advice I have for you all is to keep a positive attitude. Yes. Do not bring negativity into your fieldwork placement. Having a good smile, and just remember that you're not going to know everything, and that's okay. That's fine. Just do the best that you can, keep your patients safe, and it will all be okay.
Yeah, I agree. I think a big thing is that we have to shift our frame of mind from being a student to now being the practitioner. And so that's a little bit hard to do, especially when you're used to being in a classroom and constantly getting that feedback. But it's really time to kind of fall into the role of being an occupational therapist or an occupational therapy assistant. Like, you really have to own that role, and it's almost like you have to fake it till you make it. So but at the same time, like Joy said, you have to recognize that you're still a student, we're learning, and so be open to feedback, and just keep a positive mind, because you never know where it's going to go. A lot of people got hired after field work at the same fieldwork placement. She's one of them. All right, so before we let you guys go, it's time for the palabra del día. All right, so the word for the day is dolor. It's dolor. Say it.
Pain.
Pain. You know how to say it?
Dolor.
Yes. She had to learn it for fieldwork,
yes,
right? So, see, it comes in handy, guys. Dolor. All right, till next time. See you soon. Bye. Thank you so much.
Oh my gosh.
Dude, stop. See, we're almost done already. But still different. All right. So I have to click twice. Okay.